Today, guys, we have Monica with us to talk to you about pharmaceuticals and COVID-19 and kind of go over what we know about it. So that's long haulers, excuse me, recovering from COVID-19. So Monica, I will go ahead and hand it over to you.
Okay, so thank you everybody for joining us this afternoon. Again, I'm Monica Twitteritis here, pharmacist over at North Kansas City Hospital. I work with the infectious disease group here and wanted to just talk to everybody about the management of long COVID. So this may be repetitive, but I always think it's important to kind of review kind of the clinical course of long COVID. So this is a nice picture explaining what happened. So as you see here, you know, there's the acute infection. And for the majority of people, you know, we expect a full recovery approximately about 2 to 3 weeks into their infection. But as we have known now, there is a subset of patients that unfortunately after their acute infection have new or recurring or ongoing symptoms after their initial infection. So we call this syndrome long COVID, but there's many other terms for this. It's post-acute COVID, chronic COVID, and some that you may probably have heard in the news or on social media, long haulers. So, you know, development of these long COVID symptoms can occur in patients that have mild disease, moderate, and even severe COVID. You know, we're trying to look at the information coming ahead to see, you know, is it affecting a certain subset of patients? And what we have found is long COVID is typically seen in older ages, you know, greater than 50. It's less common in younger patients or the very elderly group, but it can still happen. Often it affects women more than men, hospitalized at symptoms. And then, of course, you know, pre-existing health issues, obesity, hypertension, heart disease. And then also we see long COVID, especially in people that present with the acute infection that have multiple symptoms. Now, time frame, you know, I said earlier that most patients recover in 2 to 3 weeks, but long COVID, and the definition is still evolving, but it's typically for patients that have 4 or more weeks after their initial infection. I think it's important for us to all remember this is a new syndrome, and medical and research communities are still learning about post-acute symptoms and why this happens. So this is a great figure that talks or explains about the complications of COVID-19 and long COVID. And I think it's important to understand, you know, there's various symptoms that are reported by patients. So why is this? So in the middle, right here, if you can see my little cursor here, that's your COVID virus. And it has those crown spikes. So the virus enters cells through these ACE receptors, which is the ACE2. And if you can see by this picture, ACE receptors are found on many of our organs. So the virus can enter the organs where it replicates, and this is why you have various symptoms reported. So for example, if the virus enters your lungs, you have dyspnea or shortness of air. You can have chest tightness or cough. If the virus enters, you know, the central nervous system or the brain, people can report like the brain fog or fatigue or sleep disturbances. So I think it's important for everyone to kind of see this, to kind of understand why symptoms can be on a wide range of reported symptoms by patients. So if we look at long COVID symptoms, you know, There's one article I read over the weekend that there's been over 250 symptoms reported. But what are the most common ones? And you may be experiencing these. But the 10 most common ones are fatigue, shortness of breath, or you just need to work harder to catch your breath, muscle joint aches, headache, cough, chest pain, altered taste and smell, and then diarrhea. The other ones reported by patients include, like this brain fog, I just feel cloudy, lightheadedness, palpitation. So when you quickly stand up, you feel, your heart beating quickly. I have had women report to me that, they have hair loss, and that's concerning for them. And then lastly, the metabolic disruption. So meaning more like new onset diabetes. So the big question I get asked is, why do some people have long COVID? Why does one person recover and have no symptoms, and others have these lasting symptoms? And the answer is we don't know yet. We're finding this information out. But what we feel is, or what we know is for some patients, symptoms progress simply because of, the organ damage that was attributed to the virus. So, if it attacks the lungs, you may have long-lasting lung issues. Could it be from the chronic inflammation from the virus causing, the fatigue that we see? The virus can cause the immune system to be overactivated, so the body can actually attack itself. Is that a possibility? Just being hospitalized for days and weeks can bring about symptoms, the muscle wasting and malnutrition. And then for patients in the ICU, there's a post-intensive care syndrome. So the medications that we've had to give patients, for some, it takes a while for it to clear out of the system. So what's out there to help me? And the big thing that we're finding out is you need to have a multidisciplinary team approach. So you need a group of physicians or caretakers to help patients that have long COVID. And you have to coordinate the treatment. So, in this series, we've had respiratory therapists, we've had dietitians, we've had, in other fields, cardiology, neurology, or so forth. But it's going to take a combined effort of all of us to help get patients through this. The other thing is there's survivor support groups out there that are connecting people so that, people can talk to one another about what they're experiencing and what has helped or not helped them. And it also provides support, to validate that, your symptoms are real. And then they also can share resources, other reputable websites to go to help kind of understand long COVID. So when I was asked to talk to this group, the management of long COVID, I think what's important to remember is that there's really no specific treatment out there for long COVID. The management focuses on specific treatment for your symptoms. So say if you have cough, what modalities do we have out there to help with, kind of lessening that cough? If you're having palpitations, working with the cardiologist to see, what's out there. But there's not a magic pill just to make everything kind of go away. So this is what, clinics are focusing on is, with long COVID management is, we have to, sit down with you and, obtain a history. When did the symptoms start? What are your current symptoms? And a simple, physical exam, checking your temperature, evaluating your heart, your lungs, and so forth. And then it's divided into down here, medical management and self-management. So with medical management, like I alluded to previously, it's really optimizing control of some of these long-term conditions. And we treat the specific complications as indicated. But what can you do yourself to kind of help you through this long COVID syndrome? And really it's focusing back on, attention to general health. It's a good diet, trying to get a good sleep cycle. If you're a smoker and you're having lung issues, it's a great opportunity to, stop smoking. Rest, relaxation. For those of people that are fatigued, trying to work every day on to increase your exercise tolerance. So it's really more about self-pace, gradual increase. And you have to set achievable targets. It's going to take baby steps to get back to a new normal. So a little bit about the more, common symptoms that people report, fatigue. So the first thing, I think of as a pharmacist when people report fatigue is, kind of really look at other causes to rule them out, checking blood work to make sure that you're not anemic, making sure that your sugars are within, a normal range. Looking at electrolytes and making sure you're also not hypothyroid. With regard to cardiac, a lot of patients report, like that chest pain or the irregular heart rate. And that's really when you need to talk to your primary care doctor or cardiologist, because there are treatment options out there, but, not every treatment is effective in every patient. There is a condition, orthostatic intolerances that we're seeing in patients where, you quickly stand up and you feel dizzy and your heart rate goes up. So it's talking to those patients, giving them education and giving them modalities to kind of minimize these fluctuations. I know you have met with a respiratory therapist, but this feeling short of breath, again, it's working with them. They have wonderful breathing techniques to kind of help you through that. But, they also, your primary care doctor also does a complete cardiac or respiratory system evaluation. Regarding, neurologic or the brain, a lot of people, the biggest complaint that I get reported is this brain fog. I just can't think correctly. And, a lot of physicians have voiced, trying to do repetitive exercise and trying to see, what triggers this fogginess. And also using, stress relief strategies. There are medications out there, but again, it doesn't work for every patient. I wanted to briefly bring up ivermectin on its use in long COVID, just because it's been in social media platforms and so forth. And I just want to remind the audience here is, it's an anti-parasite drug. And it was really used in animals or parasitic infections. There's really no information available, a good randomized controlled trial showing the benefits of ivermectin in long haulers. There's actually been a rapid increase in the prescriptions, and patients have taken various doses, and then multiple phone calls to the poison control center on this. Taking large doses of ivermectin is fraught with serious side effects. It can interact with other medications that you take, like the blood thinners. And we have seen patients report, nausea, vomiting, diarrhea. They also can have blood pressure changes, dizziness. And if you have taken too much ivermectin, it can off-kilter your balance, and worst cases scenario is seizures and coma. So, we do not recommend ivermectin for management of long COVID, just because of all these concerns we have with its use. A little bit about management of long COVID is, what about the vaccine? And there are case reports that following long COVID, people that do get vaccinated, there are case reports again about resolution, meaning their symptoms have gone away. But for others, their symptoms progress. What we have seen is, some of the literature reports either 30 to 40% of patients following vaccination against SARS-CoV-2 have symptoms resolution. And most of those patients, it's with the milder symptoms like the brain fog, loss of smell or taste, or fatigue. The patients that do not report this benefit is really like the long ICU stays, more of the pulmonary problems, the pulmonary scarring or interstitial lung disease. But I did want to bring out that there are case reports of the vaccine helping with this. Why do patients feel better after they get their vaccine? It's a good question, and we're still looking into that. We don't know the answer. There are some theories out there after interviewing the patient, the vaccine may actually help their immune system finally clear the virus. Or the vaccine may actually charge up a person's immune system and shift it back to, a state of balance. So it's a very interesting phenomenon, and, we continue to kind of watch this area of information. So, just kind of to summarize, what's out there for the long COVID. I think it's important to remember we're continuing to learn about this syndrome, and it's going to take us time to figure out, the mechanism, what are the risk factors, and really how to treat this patient population. Long COVID can affect people in very different ways. That's why, when talking to patients, every one of you may have different symptoms. And so there's not a one size fit all approach. We have to take care of patients. It has to be personalized to everyone's experience. And the key is to, maintain open lines of communication with your doctor or other healthcare team members. And also, if you find a good support group, that also can help you along this process. Briefly, a little bit about social media. I would say be cautious, especially if you come across treatment modalities on social media. I'm always fearful of scams. If it sounds too good to be true, it may be. So just be careful out there. Kind of do your research, and then also rely on your healthcare team members to kind of help answer any questions that you have. I did provide some patient resources here for you. There's a www.longcovid.org, and then also a CDC website link that also has some great information on long-term COVID. With that, Shannon, if there's any questions, I don't mind entertaining those.
Okay, Monica, thank you so much. I learned a lot out of that. So I would like to take a moment to let people know that we are recording this, but you can ask your questions in the Q&A function or in the chat function. So let's see if any questions come in, Monica. Thank you again so much for giving this presentation. I know that there's definitely a lot of information out there that people have maybe just heard from someone else, or maybe they've looked into it and they still had questions on. So I really appreciate it. Let's see, do we have any questions? Okay, well, if you come up with any questions afterwards, go ahead and reach out to me, and I will be sending you a link of the presentation so that you can watch again or share it or reply back to me with questions. Monica, I want to say thank you so much for your time, and that was absolutely perfect.
Oh, you're very welcome.
All right, have a good day, guys.